Well, the American Cancer Society just released their cancer statistics 2025 report. It is the organization's annual report on cancer facts and trends. The study finds cancer mortality continues to drop despite rising incidence in women, and the rates of new diagnosis under 65 are higher in women than in men. Joining us now to break this down is Dr. Susannah Hills, assistant professor and surgeon at Columbia University Medical Center. Thanks so much for being here.
My pleasure.
Alarming for us in particular to read. Why is there higher rates for women than men right now?
Yeah, this is really interesting. And of course, cancer is concerning for everybody.
Sure.
It's the leading cause of death in people under 85. But for women specifically, women are almost 2 times more likely to be diagnosed with cancer under 50 compared with men. Why is this happening? Well, there are probably many reasons, but let's look at breast cancer, which is the most common cancer by far in women.
Yeah.
1 in 8 women will be diagnosed with breast cancer, and the numbers are rising. That's likely because we're getting better at diagnosing many of these cancers. Screening tests are being recommended earlier for some of these cancers, so we're picking them up. But there are factors in our lifestyle that are also having a significant impact. For breast cancer, delayed childbearing, less breastfeeding, does in fact increase your risk of getting these cancers. Breastfeeding and pregnancy are protective against breast cancer.
Interesting.
It's not to say people
Didn't know that.
Right. So it's just important to know.
Okay.
Also, the foods that we eat are likely contributing. Obesity is a significant contributor to cancers, to many kinds of cancer, colorectal, breast cancer, but also the foods we eat. Red meat, ultra-processed foods contain factors that can be cancer promoting.
Now, what's the average age a woman should be getting that mammogram to kind of check to make sure nothing's going on that's
I'm glad you bring that up, Bianca. So it depends on your risk factor. But for women at average risk who don't have a family history, the mammogram screenings are actually recommended earlier than they were previously. The guidelines were just changed last year. They're recommending them to be considered at age 40 instead of 45.
Oh boy. And if you have that history of cancer in your family, what age are we looking at? 30?
Yeah, it depends on the level of risk that you have.
Okay.
And so the recommendation then is to get guidance from your primary care doctor and potentially a breast oncologist to figure out what type of imaging you need, because it may not just be a mammogram. You may need an MRI, you may need ultrasound, other kinds of imaging, and they will likely recommend doing that before age 40.
Gotcha. I know we kind of briefly spoke during the break about some of these other screenings that people do. I mean, I know insurance doesn't cover this, but if you're at a higher risk of cancer, would this be an option for people?
It is an option. I will say it's important to put these kinds of tests in context, right?
Yeah.
So they can be very useful. There are all kinds of risk factor assessments and screening tools that oncologists use. So yes, they can be very useful for assessing your risk, but typically they're recommended when there are other factors that might make you more prone to being at risk for cancer, a family history, a prior history yourself of having a certain type of cancer. Then getting some of these tests is more useful. But again, there's certainly many people are being proactive, getting these tests done, and they're finding out that they are, in fact, at a higher risk than they knew previously.
I feel like this is a lot of doom and gloom. Before you go, at least give us some hope of like what we can expect, if at least in 2025, to help us combat these stats.
Well, overall, remember that survival rates for cancer are absolutely going up. People are being diagnosed earlier, but they're surviving. Our treatments are getting better, and there's a lot of hope for new therapies like gene therapy, like vaccine therapies that really might further increase our survival rates and really help move things forward in the next year or 5 years, 10 years.
Interesting. I like to see that the medicine there is advancing, in the next couple of years. So we'll see what happens. Dr. Susannah Hills, we appreciate you being here.
You bet.
All right, more noon coming up straight ahead.